Hello, I am your host, Kathy Chester, and welcome to the Move It or Lose It podcast, a podcast about all things that move the mind, body, and soul. The Move It or Lose It podcast is for information, awareness, and inspirational purposes only. I am not a doctor, and I don't even play one on TV, so please consult your doctor before making any medical decisions. The views expressed by advertisers, guests, or contributors are their opinions and not necessarily the views of the Move It or Lose It podcast. Hello, welcome to another edition of Move It or Lose It. Today, you might have remember a long time ago, I think it's been 3 years, I interviewed Dr. Feinstein, and it was when the first book came out, the Mind, Mood, and Memory. So if you've not read it and you have vision problems like I do, it is on Audible. So make sure you snag that up on Amazon. Dr. Feinstein, I'm so excited to have you back again. You actually were the person who encouraged me to get into some neuropsychology and cognitive therapy. And so that was really a blessing to me because I knew I needed it, but I had kind of put it off. So it was thank you for your wisdom, sir.
Well, my pleasure. And I'm very pleased to be back. Thank you for the invitation.
Absolutely. So I know I want to go into your other book in a bit, but how are you doing first off?
I'm doing well. Thank you. Yes, all
Good.
good. All good.
And you're still that. So just people that have not seen the other interview that I did with you. So first off, your education takes about 45 minutes to read, but you were born, I always find it interesting. You're born in South Africa.
Correct. Yes, that's right.
And from the time you were a little boy until what age?
Oh, I lived there until I was 29 years of age. So I lived there
Okay.
a long time. I went to medical school in South Africa, but I did my specialty training in the United Kingdom.
Yeah, you did that. And that's where you went to, when you were in London,
Yes,
that's where you completed your psychiatry training, right?
correct. Yes, and that's where I did
Okay.
my PhD as well. Correct. Yeah.
Okay. And where did you do your MPHL, your master's in philosophy?
London as well.
Okay.
All my degrees after medical school come from London.
And you said, see ya. No, so you were there for a bit and then you
I
came.
was there for 7 years, and then I got a really
Okay.
lovely offer from the University of Toronto to come across and start up a neuropsychiatry clinic at the university, which is what I did in 1993.
Okay. And you're still there.
I'm still there, very happy to be.
Yeah.
Yeah.
That's and so I know I've asked you this before, but no one in your family had multiple sclerosis. You don't
No,
have it.
no.
But what got you so intrigued with as far as the cognitive, the mind? I love, by the way, right now as our podcast is going, there's about 14 people doing their lawn right now. So
Right.
no
Excellent.
background noise. So
Right.
what got you so interested in the cognitive areas?
So when I started to do my PhD, MRI was very new.
Hmm.
MRI had just come into
Right, that's
clinical
right.
practice. And that
Hmm.
was one of these, great moments in medicine because suddenly you had this remarkable technology that allowed you to look at the brain with very great clarity, much better clarity than a
Right,
CT scan, for example. And so,
right,
so the MRI really showed people who were interested in MS
right.
these lesions in the brain, which you really couldn't see with the CT scan.
Sure.
And so when he got that image, it begged the question, well, what were these images doing? And from
Right,
a neuropsychiatric perspective, the question was, how is this affecting cognition? Or
right.
how is this affecting mood? And
Sure.
that's what I started to study with my PhD. So
Yeah.
really, it was driven by technology. It was having this new tool called MRI, which really was a game changer.
Yeah, absolutely. For sure. And so finding that with the I mean for us, even through the years how it's changed. I mean, I'm going on my do I get anything for going like 20 something years with MS? When you hit 30 years, do I get a prize? I don't know. But so, I mean, I remember, I mean, it's interesting to me how the MRIs have changed through
Yes.
the years. And, I never want to tell when I have my newer support group with people that have been just diagnosed. It's the best time. I try to never say that because I remember them telling me that. But now the MRIs are so different and even stronger. And I know not telling you something you don't know, but they're even getting better. And so
How
it's
much better?
exciting.
Yeah, I mean, I'll give you an example. So when I did my PhD, the field strength, which is the strength of the MRI, was zero
Uh,
point 0.15 Tesla. Now it's 3 Tesla. So it just
wow.
shows you zero point 0.15 to 3. It's a huge
Yeah.
leap in terms
Yeah.
of sensitivity and what the machine is able to show you in the brain.
So I know how spider webbing. So in your impression, what are some of the greatest advances for MS as far as the MRI that we can see now that we couldn't, as far as the
All right.
lesions? And I
Yeah.
know there's all that talk and disputes about the gray
Right.
lesions. I know there's all that, but what would you say?
So, well, number one, you can see a lot more lesions with a more
Mm,
powerful machine.
mhm.
You're also able to look at the degree to which the brain shrinks. We call that atrophy. And
Yes.
that's a very important clinical
Yeah.
marker, which I'll explain a little later. And now we've got sophisticated MRI that allows you to look at parts of the brain that look normal to the naked eye, but it's not. So you can extract
Yeah.
information from normal appearing brain tissue that basically gives you a clue as to what's going on at a much more micro level. And you can
Yeah.
look at pathology that way as well. And that's also been key to understanding this disease. So, you've
Okay.
got your lesions, you've got your
Yeah.
atrophy, but then you've got all these very subtle metrics that you can get
Right.
normal appearing brain tissue that give you further information about the progression or lack of
Right.
progression of the disease.
Which is so crucial.
Yeah.
And so I'm glad you're going to explain this next because I don't make me explain it. So the atrophy and all that, and the parts in the brain that you were talking about, like the different things that you can see, the gray and all that. Explain that.
All right. So yeah, the brain has the white matter where there's the
Mhm,
myelin, and that's
mhm.
always thought to be very typical of multiple sclerosis because MS is a demyelinating disease.
Right.
But as we've got more sophisticated with our imaging, we now know that there's also myelin within the gray matter. And so we know that there's gray matter disease in people with multiple sclerosis as well.
Right.
And indeed, the gray matter disease may be even more important when it comes to things like cognition.
Yeah.
So sophisticated MRI allows us to have a very careful look at the brain, at the white matter, at the gray matter, at parts of the brain that appear normal. We look at all that information. We get metrics that tell us about how stable the disease is, how rapidly it's
Right.
progressing, etc. We can monitor that. So MRI becomes, in many ways, your very best biomarker of the
Yeah.
disease.
Right. Absolutely. I think that because it's funny because cognitive issues were one of my very first things. So I was in my maybe just 20. And I was driving and realized instead of driving myself home, I ended up following my cousin back to her house. Adding, subtracting, those kind of things just left me. So it's funny because through the years and different neurologists will say, well, cognitive stuff they don't even happen until you're much older. And I'm like,
No,
not
that's not true.
true, not
No, it's not
true.
true.
So and so I
Uh,
think that gets nerve-wracking when I would say red flag when that happens, or if you're in a neurologist's office and you ask for a um, a neuropsychologist or a cognitive test, and they don't have any answer for you.
all right. So you raise a number of important points there. Number one, cognitive problems can begin very early in the disease. They don't have to, but they can.
Right.
And sometimes they can be present from the very beginning.
Hmm.
So that's why it's very important that you have access to someone who can test you and see what
Right.
your cognition is like. And that testing is generally done by neuropsychologists or people trained by neuropsychologists.
Right.
And there's now a very clear recommendation that everybody with MS should have a baseline cognitive assessment
Right.
because cognitive difficulties can begin early and they're also very common. So, for example, if you've got relapsing remitting MS,
Right.
about 40 to 45% of people will have cognitive difficulties.
Hmm.
If you've got secondary progressive MS, 60 to 70% will have cognitive problems. If you have primary progressive MS, it may be even higher. So you
Wow.
can see a lot of people with MS will
Yeah.
have cognitive difficulties. You need to document them,
Yeah.
but you can follow them over time to see whether they're getting worse or are they stable.
Right. Yeah. Very much so. I see that. Even I've remained in relapse and remitting, but I can see, how things and so that goes to my second question. And I asked you this before. We chatted a little bit before. Um, do you notice a big difference in what you're doing now and I shared with you this year, and my listeners know, has been more of a traumatic year for me. And do you notice people that are having more of a traumatic year and they're feeling like, oh my gosh, cognitively, now this is happening. I can't remember this. And people are seeing it visibly. Do you see it once things have calmed down for them, cognitively, they're able to do better? It's not,
A couple of things.
okay.
So stress
Mhm.
potentially can worsen MS symptoms. We know that.
Sure.
It was a fascinating study done by my colleague David Moore. At the time, he was at UCLA.
Okay.
And he had a group of people with MS and he gave them MRIs every couple of weeks. And
Mhm.
one half of the sample was given stress reduction therapy, and the other half was given no therapy. And he looked at the MRI and he showed that the individuals who got the stress reduction therapy had an improvement in the MRI
Wow.
because of the therapy. And then when the
That's
therapy,
fascinating.
it is, and when the therapy ended, the lesions started to get worse again. So stress
Wow.
can be problematic for the disease, absolutely. But the other
Well,
point is,
I'm screwed then. No, I'm just kidding.
you're not. I think you're resilient. But the other point is this: when you're stressed, when you're emotionally troubled, I'm sorry, I have environmental lights. I keep on.
I was like, wait. My eye really went bad. The
Yeah.
optic neuritis is bad.
So when you're stressed, when you're emotionally
Yes.
stressed, it can distract you. It can impair your performance because you're distracted by your emotions.
Yeah.
So that's the second problem. So you've got to be careful of that. Now, if you can correct the stress and you can get yourself towards a point of greater emotional stability, then potentially those kind of cognitive challenges that you face can improve.
Yeah. Yeah. What would you say even if someone has so much going on? I'll hear from, different clients that I work with. And I told you I work with people that have all the fun things that I have and different things, Parkinson's, stroke. Even if it's 10 seconds, go in a room and just two big deep breaths, even if it's that you can get your mind, or doing some of the things I'm sure you give out, like black, there's 5 black of these, 4 red of these, something that just, retrains and gets the thoughts back. So it's not that flight or fight, and it just can kind of
Yeah, well, I'm a big proponent of therapy. So in other words, if you've got a lot of stress, if you're feeling anxious,
yeah,
if that's impeding your quality of life and getting in a way of you functioning effectively, you really do need therapy. And
yeah,
the evidence suggests that there's some really good psychotherapies for
yeah,
people with multiple sclerosis that we can talk about. The
100%.
the
Yeah.
other thing that's really fascinating since I last spoke to you is that the clinic that I run,
Uh-huh.
we've introduced cognitive rehabilitation therapy.
Okay.
This is the therapy that is geared towards actually improving a person's cognition. So if someone comes to see me and we do the cognitive assessment and we find out that they've got memory difficulties,
Uh-huh.
we bring them in for a 5-week program,
Okay.
sessions a week, trying to actually improve their memory.
Wow, I love that.
If they've got processing speed deficits, we'll bring
Yeah,
them for 5 weeks of therapy, 2 sessions a week, 45 minutes each session, to improve their processing speed. So
I love that.
we now have interventions which we didn't have a
Right.
couple of years back, that we think
No,
can subtly improve your cognition.
I love that. Now, how are we going to get more hospitals to get that?
That is such an important question because um, the therapy that we use is a computer-based program.
Hmm.
We buy it from a company that has programmed it. They're a German company. The program is called RehaCom. It's a very widely used cognitive rehabilitation program, but you have to buy it. You have to
Hmm.
purchase the license. The clinic
Okay.
that I work at has over 10,000 people with MS.
Okay.
There's a very high clinical need, and we cannot give it to everyone. And indeed, we now know
Right.
that not everyone is going to benefit from it. So we have to work out
Right.
who do we think is going to get the maximum benefit from the therapy, and then we target those individuals to try and get the maximum bang for your buck, as it were, from this program.
Right.
So we have to be very selective about who we give the therapy to.
Right.
And we're
Right.
learning as we go because this is new. This is new territory. What we're doing is very innovative. Not every clinic has this kind of intervention for people with MS.
Right.
As we use it, we learn. And we're learning from our experience. We start getting who's going to get better, who's not, who do we give it to, who do we say, no, this is not for you. This is all part of our learning process. So although we have 11,000 people with MS, of whom at least 50 to 60% are impaired, we cannot give therapy to 5 or 6,000 people. We don't have the manpower.
Right. Right.
Impossible.
Of course not. Of course not. Yeah, so it's you just are deciding who will get the most benefits from it, who's going to make the most progress from it, and
Mhm.
so on and so forth. So very interesting, very exciting that you guys are doing that because I
It is.
often think about it's funny, I often think if I could have a couple weeks that I'm just working on this, and
Yeah.
then I'm just working on this part. So very fascinating,
Yeah,
very
and in
neat.
fact, we can give the therapy virtually. So it's 2 sessions a week, and the person can stay at home. They log into the computer, the therapist joins them, and we
Yeah.
walk them through this program, starting at a certain level and building up with complexity. So that at the end of the 5 weeks, they're doing things that they thought they couldn't do at the beginning of the session.
Wow. Yeah, that I love that. Now, are you able to do it's only through your hospital though, so it can't be like someone who's not a patient.
Correct. That's right. Yeah. So, so within the Canadian healthcare system, the
Yeah,
person has to be referred by a doctor to my program, and then we have a look at them,
sure.
the assessment, and bring them in. But the program that we use, Reacom, is available. Anybody
Yeah,
can buy Reacom. I think it costs something like 3,000 euros. So you can buy the program. The program is there. It's out there in the public domain. We
right,
use that
right.
program because most of the published MS literature on cognitive rehab uses Reacom. So there's some good data now to show that Reacom can indeed help people with MS.
Good. That's
Yeah.
very good. I
I
wonder
just want
if
to say, I
anybody
don't want to overstate the benefits. So people come in, their
yeah,
cognition might improve with the program. We do not yet know whether that improvement translates into real world benefits for them.
sure,
That's
sure.
really the clue. So, you come in, you do very nicely. The program shows that you're doing much better on the program, but does that translate into improvements in your life from day to day? We're not sure
Right.
about that yet. And that's one of the key variables that we've now got to tackle.
Yeah,
We want to give a therapy that's meaningful.
right. Right. Absolutely. Yeah. So it's all in stages trying to figure that. I mean, it's gonna
Exactly.
take absolutely. No, thank you for sharing that. I love that. Um, okay, back to you. So I've got that part down. I got all of the history of all that you've done as far as your degrees. Um, so obviously we talked about where you started. What do you think the numbers cognitively have gone up since the pandemic? Introducing the Pulse device. Cutting edge wearable device, revolutionary wellness designed to stimulate circulation, reduce harsh pain and tightness, and speed up recovery. The Pulse device uses advanced vibrotactile technology trusted by patients, clinicians, and wellness professionals. Whether you're recovering from an injury, battling a neurocondition, or just want to feel the best every day, Pulse helps you recharge so that you can live and feel better. Lightweight, powerful, and easy to use. Experience better performance, better recovery, and a better you. Order now and save $30 using my code MS Disrupted at pulsedevice.com. The Pulse device is your health recharged. You won't be disappointed. Get it now for yourself. I have it. I love it. Go ahead and grab it.
Great question. Um, I think if you did get COVID badly, it may well have worsened some people's cognition.
Okay.
There's no hard evidence to show that globally but the level of impairment has gone up. But I think for certain individuals who have COVID or long COVID, they can certainly struggle more cognitively.
Okay.
But the pandemic was a very, very difficult time, as you know.
Sure.
And it cut people off from so many activities that are good for us. And
Right.
that's really important because people with MS need to keep their brains active. They need to do things. And you've got all these restrictions that says, you
Yeah.
can't socialize, you can't do this, you can't do. You're cutting out many activities that can boost your
Right.
cognitive reserve. And that's
Right.
one of the big challenges that people with MS face is that they were cut off from
Yeah.
activities that could boost their cognitive reserve.
For sure. Definitely. And I always get curious because I notice like doing what I do with people that are physically healthy, don't have MS, and people that have MS, I noticed with both. My clients that were healthy would come in struggling cognitively almost the same.
Yeah,
And I always checked it with me. I was like, okay, I'm remembering more than they are, so I'm okay. But I noticed even after I'm still seeing a lot of the clients and a lot of people still really struggling cognitively. So I
Mm.
thought I wanted to ask you, are you seeing that in the clinic and stuff? Just it just the struggle and it just not coming back yet. It's just really
Uh,
such a
you
hard
know,
time.
I think the individual patients who are like that, overall, I think the situation is probably pretty close to what it was before the pandemic. What the
Good.
pandemic has done, what it's done in a very profound way, has completely changed the nature of practice because
Yeah.
now people don't come into hospital anymore. It's all done
Right.
via Zoom.
Right. Right.
That's striking. And as if you had to look down our corridor outside our department. If you've got a very big department, the
Yeah.
corridors are empty because the patients are not here.
That has to be so weird.
So the whole nature of how you administer mental health therapy is
Right.
fundamentally changed by the pandemic.
Right. That's
Yes.
how I do mine is through, telehealth. I do it on Zoom and absolutely. And I think too, I mean, one of the good things I think that came out is it united us as far as I know we sometimes the internet is so discouraging, but it united us in different countries, in different areas that it was like, oh gosh. And I mean, I know that I have had so many different friends and so many different people that I've met through the pandemic that I still have good relationships with. And so
Yeah.
I think, and so many different support groups that are still running and doing very well through
Yeah.
that because there's that desperate need to connect.
Yes. Yes.
And
It's
so
very
we
true.
found it regardless. It was like, if you wanted to, you found a way. Of course, the scary thing is, as we've talked about before, and I love that you put that, is you're studying, in the beginning, we talked about you're studying through the imaging depression in MS. So, of course, we're talking about disease, that depression is a part of the disease.
Yes.
So, you have people that are getting more depressed and they're going to stay introverted and stay in.
Right.
So,
Huh?
that was difficult. I'm just
Yes.
obviously.
It was very
Um,
hard. Very hard. You're right.
I hear this a lot. I'm not depressed, I'm anxious. As a psychologist, how do you help as far as medication or exercises? How do you help someone understand
Okay.
if there's a difference or there's not a difference?
Yeah, there's a difference. Just a quick correction. I'm a psychiatrist, not a psychologist, but I do this in.
Sorry, sorry, sorry.
That's okay. But you're right. Anxiety is not the same as depression. It's different. And you've got to work out clinically, is the person suffering from anxiety? Is it depression? Or frequently, is it both? You can be
Right.
anxious and depressed.
Mhm.
And so once you've followed the medical model and you've made your diagnosis, that's when you've got to recommend treatment. And the treatments fall into two broad categories. You've got your medications or
Mhm.
you've got your psychotherapies. I can tell you that
Okay.
most people want psychotherapy, not medication.
Yeah. Yeah. Yes.
But people still take medications. Some of the medications can be effective, certainly. Medications might come with side effects, so that could be a potential problem with medications. But
Right.
there's definitely a role for medication. But the
Right.
majority of people want psychotherapy. And then the challenge is you've got to have access to a psychotherapist.
Right. Right.
Got to have the therapy there. You've got to have the therapist to give it to you. And there are many different kinds of therapy, a couple of which we know now are very effective for people with MS. Number
Okay.
one, there's cognitive behavior therapy,
Right.
which is helpful for depression and anxiety.
Yeah.
Also, mindfulness-based therapy, which is very helpful. And we've got good research data to show that both of those therapies work. Interestingly enough, with the world becoming more computerized, there are
Mhm.
now computerized cognitive behavior therapy programs, computerized CBT programs. So the
Really?
computer provides the therapy.
Of course it
And
would, right?
the research data shows that some of those programs can be very effective as well.
Wow.
So if you don't have access to the in-person therapist,
Right. You
in
can go
theory,
to
you might
the
be able to get your therapy from a computerized CBT program for your anxiety or your depression.
never did I think that would happen.
Yeah, that's moving more and more in that direction.
Wow.
Yeah.
Okay. Interesting. Okay, so my next question is, you also talked about the depression and the confusion using cannabis, because of course that's a big thing with MS. Even in the online discussions, a lot of people use cannabis.
Yes, a lot of people use cannabis, correct.
Mm,
We find that at our clinic, when we test the urine of patients, about
mm,
one third are using cannabis. It's very high.
okay,
Now, with any drug, you want to know what are the benefits and what are
right,
the side effects. So patients tell us they find the cannabis helps their pain, or
Hmm.
their spasticity, or their urinary symptoms, might help them fall asleep at night, might help
Hmm.
with their anxiety, or sometimes it's just a lifestyle choice. I want to use cannabis because it's my lifestyle.
Right.
So the patients say to me, look, the cannabis is helping me. I listen very carefully to them because they know
Right.
it's their life. They know what they feel.
Right.
But we also have some data to show that a particular form of cannabis THC,
Mm.
not the CBD, the THC, probably causes cognitive difficulties as well. And so
Sure.
if you've got a disease that's already giving you some cognitive problems, you potentially make it worse by using cannabis THC. And that's what we tell our
Right.
patients. You've got cognitive problems. Why don't you come off the THC and see what happens to your cognition? Now, like
Right.
any drug, some patients will say, well, I'm getting so many benefits from it, I want to stay on it. So we accept that. Of course,
Right.
but we have this discussion about the advantages and the disadvantages of cannabis use.
Sure. Sure. Absolutely. No, yeah, I agree. I see the same things. I'm just like, well, I not sure that's the best for you. So,
I
yeah,
mean,
I'm
the
sure
good, the
that
good
happens
news, the
often.
good news is that when you stop cannabis, and we've got good data that shows when you stop cannabis, your cognition can improve.
Yeah.
It's not as though like you're frying your cognition by using cannabis. If you
Right.
stop, your cognition
Yeah.
can bounce back.
Yeah, for sure. Definitely.
Uh,
Yeah. And I see that a lot. And it comes up in the groups all the time, and then it becomes kind of like this big argument thing. It's like, okay, we're off topic. So I can understand, I can imagine how big it becomes.
is cannabis legal in Michigan?
Yes.
Oh,
Yeah.
yeah.
Yeah, definitely it is. And and I've definitely found different things like the CBG, CBN, things that have anti-inflammatory stuff. But it's a misunderstanding of, I just need more THC. I'm like, no, no, no. But it just gets to a point where you can't keep arguing that because if that's their lifestyle, like you said, that's their lifestyle.
Yeah,
And so,
make people a choice, right?
yeah, absolutely. So, anything else before we go on to your new book? Anything else that you'd like to talk about as far as what you're seeing now as a psychiatrist, and anything's coming up that you're excited about?
Yeah, I mean, I think the big advance for us has been we are now using cognitive rehabilitation for the first time. So, for
Yeah.
many years, you would do the testing and you would show that the patients have got deficits. Okay? And then, and then, the question will be, well, now what? You found the
Right.
deficit, but you can't do anything about it. Now we think
Right.
we may be able to change it through cognitive rehab. So that's, I think, potentially a very significant advance. Although we still have to tease out the nuances and we still have to work
Yeah.
out what are the real world benefits. So that's a big change.
Yeah. I'm
One,
excited about that.
yeah. The other one is that, you know, conventional neurology now recognizes that cognitive problems and depression are very common in people with MS.
Yeah.
And I know it sounds obvious to you when I say that, but when I got to Canada, 25 years back, and I called all my colleagues in neurology, they would say, "Why are you doing this work?" They never saw the cognitive and mood problems because they studied
Yeah.
quiet, so they
Yeah.
were being missed. Now,
Yeah.
with the younger generation of neurologists and through education, there's a very broad recognition that this is very
Yeah.
important. And so with my clinic, which is attached to the MS clinic, all the neurologists refer to us. They send the patients in for testing. They recognize that this is absolutely pivotal to good clinical management. And
It's
that's
so
good.
good.
Yeah.
It's so important because I mean, I've had it that long where that was never even brought up.
Yeah.
Never brought
Yeah.
it. And never, no one ever said anything about cognitive anything.
Yes.
Um, I
Yeah.
remember actually the first time it was brought up, this will bring you back, is one of my neurologists said, "You're going on Tysabri. You will never have to worry about anything cognitive again."
Oh, is that so?
So I thought, like,
That's a that's,
hallelujah.
that's
So
a very dramatic statement, right?
yeah, I remember hearing that. I was so excited. I thought, I'll be able to add again, subtract, no more cognitive, but that obviously wasn't true.
Yeah.
So, but it was very, I just think they didn't know. They just didn't know.
Yeah, and
So,
it took my profession had to educate them about it. Absolutely.
yes, thank God for you.
And medicine can move quite slowly.
Yes, it did. We are very grateful for what you have done because I know getting my cognitive therapist was a huge blessing. I mean, it has been definitely it has helped a great deal, and I know for many others. So
Yeah,
it is
I'm very
it
pleased.
is huge.
I'm very pleased.
So Now, totally going to a different area, but very interesting. I think that's what I love about this podcast is we can go different areas, different things. Your new book is The Front Line.
Yeah, it's moral courage, right?
Moral
Yes.
courage. I have that front line because I want to ask you about that.
Right.
Moral courage. Where did you? What helped you do this? I know it's about. Well, you tell me.
Right. So, it's about journalists who
Mhm.
live in countries that have very poor records of press freedom, and they still want to tell the news. They still want to tell the story. So,
Yeah.
so these are countries like Russia, Bangladesh, Iran, Zimbabwe, places like that, where
Yeah.
the regimes are very brutal to journalists. And when you
Right.
go after journalists, you're essentially destroying civil society because if the news doesn't come out, what kind of society do you live in? And so
Right.
these are the journalists who take enormous risks and they show incredible courage to essentially keep their countrymen, country people informed about what's going on. And the question that intrigued me as a psychiatrist was, well, why do you do this? Because you know in advance, just if Russia as an example, if you um, write bad things about the government, if you basically call out Putin for all the things that he
Right.
does wrong, you're going to have a very hard time with it. They're not going to silently accept what you say. They come
Right.
after you. They'll lock you in
Right.
jail. They'll beat you up. In fact, they might kill you. And
Right.
despite this, very great dangers, the journalists still do it. And it comes back to this idea of moral courage. You have to have physical courage to do it, but you have to have moral courage.
Right.
And
Right.
that kind of moral courage that these individuals have, and I focused on 18 journalists from different countries, that kind of moral courage is very, very unusual. The kind of person who will step up and say, never mind what you're going to do to me, I am still going to report the news. I'm still going to keep, the country informed of what's going on. Um, and so it's an in-depth inquiry as to what motivates these people, why do they do it,
Yeah.
how do you explain their behavior? And
Right.
it's really relevant to our world in general. How do we keep our moral compass in difficult times?
Right. Right. And where does that moral compass come from?
Yeah, and that's the intriguing question. So when you look
Right.
at individuals, there are 18 essays in this book, one devoted to a single journalist.
Uh-huh.
Uh, you could take the two journalists from Russia, for example,
Uh-huh.
one of whom was murdered on Putin's birthday.
Wow.
Yeah. The other one had to flee and go into exile after Russia invaded the Ukraine. So why are they doing this work? Where does that courage come from? And there's going to be all sorts of complex reasons why they do it. But the gist of my argument is this: if you keep quiet, if you don't say something, you compromise yourself morally.
Right.
So there's something there called moral injury. And what is moral injury? Moral injury is a condition that can arise from perpetrating or witnessing or failing to prevent acts that transgress your moral compass. And it comes from what other people do, acts of commission, or what you do, but also from what you don't do. I
Right.
kept quiet. I should have
Yes.
said something. And I think for these journalists, keeping quiet is intolerable.
Yeah.
If they keep quiet, they feel they are compromising themselves morally to such a degree that they can't live with themselves.
Yeah.
So even if by speaking out, they know that, the government is going to come after you and lock you up or beat you up or take away your money, they still feel that by speaking out, they've maintained their own moral compass.
Yeah.
Now,
Yes.
it's extraordinary to do this because the consequences are so severe.
Mhm.
We're not talking about these journalists having a minor
Right.
inconvenience. We're talking about these
Right.
journalists who might get killed.
Right. Who
Or
are
they get locked
literally
up in
going
prison.
in knowing that. Yeah.
Get locked up in prison for,
Which
5,
could be
6,
worse.
8 years. Absolutely, and yet they still do it.
Yeah.
That's what the book is about.
So the first one that you tell me about the first one that you opened up with in the book.
Right. So this was, I believe, a woman that came from Namibia.
Yes.
Her name was Gwen Lister. And she actually was a South African journalist, but she went to live in the neighboring country of Namibia. And this was during the apartheid years when there was very strict racial segregation.
Yeah.
And she found apartheid morally offensive.
Hmm.
And she campaigned to have a free press in a country that really wasn't free because of apartheid. And so, the government came after her very hard. They would try and um, break the newspaper. She would be threatened. The work was dangerous and very, very stressful. Um, it cost her, I believe, her two marriages because her husbands couldn't live with the heat, as it were. It was just too
Sure.
difficult to be married to someone who was, constantly under threat and danger. But she stuck with it. She stuck with it. And at the end of the day,
Wow.
Namibia became independent and the press became free, and there was a free press. So it was a remarkable outcome, a great
Yeah.
success story. But she was instrumental in helping that happen. And then the fascinating part was, after there was a democratic government in power,
Uh,
came to Gwen and said to her, "You were so helpful in terms of your fight. We would like to offer you a government position. We'd like to offer you head of the broadcasting." She turned it down. She said, "No." She says, "I do not want to be close to government. I need to be
wow.
separate from government so that I can call you out as well
Right.
if you
Right.
transgress." And
Right.
she did that. And so she had this, remarkable moral compass
Right. It's very strong moral compass.
that never bent over decades
Wow.
of doing this kind of work, even though the cost to
Wow.
her at times was very, very high.
Wow.
Yeah.
Very, very interesting. Yes.
Inspiring people, very inspiring.
Yeah.
Yeah.
So now is this one on Audible yet or no?
No, it's not. No, it's just the hardback version.
Okay. Well,
I mean,
it'll
the
be at
Audible
some
thing, the
point.
Audible thing right now is, you probably know this, it's becoming AI driven,
Yeah. Yeah. And I can do that as well. So it doesn't, I can do that. Um, the only thing on the Audible is that I love your voice. And when I got it, I was like, whose voice is this?
All
Where
right.
is
No,
Anthony? So
no.
I was bummed about that. But at least I got to, I could read a little bit of it, but my eyesight's so bad. But I was very excited about that. But you're right, AI is a great gift. So
Uh-huh.
I can do that. So I was very excited to see that book and thought, gosh, this is something I really want to read.
Well,
So
it's relevant to where we find ourselves as a society as well, because the press is under pressure
right.
in many places. There's a whole thing of fake
Mhm.
news, and journalists are getting demonized and they're getting
Right.
harassed, etc. And so
Yeah.
um, it's not easy to be a journalist at times,
Right.
even in democratic countries. Although it's much, much more difficult in places like Bangladesh,
Yeah.
and Zimbabwe, and Russia, um, Turkey, India. India,
Yeah.
there is this great democracy, but if you're an Indian journalist and you say something that the government doesn't like, and I wrote
Then
about
that's it.
they try and break you. They try and break
Yeah.
you.
That's
Bogus
what
lawsuits. Yeah.
I thought was so, I when I went to India, I was in India 2010, and I went as a missionary, and I was there in Hyderabad. And so, I mean, I had to be very aware of every move I made, and I was helping with schools and stuff. And so, not a journalist, but we saw journalists there, and it was, you were very proud of what they were doing. And so I think that's why I immediately was drawn to this book, is because,
Uh-huh.
I've been able to see in some mission stuff the journalists that come to do the things that a lot of people don't have the courage to do.
Uh-huh.
So I think I'm very proud of you, Dr. Feinstein, for writing this book
That was very sweet
and
of you. Yeah. I mean,
really putting
your
it out there.
observation about India is really important, because the Indian journalist that I wrote about, her name is Neha Dixit.
Okay.
She's harassed sexually in the most vicious way.
Mm.
That becomes their main form of intimidation, which is
Yes.
relentless sexual harassment online, and
Yeah.
also bogus lawsuits. They
Yeah.
try to break you with bogus lawsuits, and you've got to defend yourself, because if you don't, you can go to jail. But the government keeps the lawsuit running and running and running and running. So they're trying to wear you down, to ruin you financially, to
Yes.
cast doubt on your credentials. So they go after journalists in a very, very nasty way.
Yeah. Very
Yeah,
vicious.
and that's India.
Yeah. Yeah. Well, I thank you for that. I'm looking forward to this. And if you had to say one thing to an MS patient that feels cognitively like they have just kind of given up and that they're too far gone,
Right.
what would you
Okay.
say?
I tell them, you want to keep your brain active. That's the best medicine. You want to boost your cognitive reserve, and you do it by keeping your brain active. And you do that through intellectual activity, social activity, and
Mhm.
physical activity. So if you can,
I was waiting for that.
that's it.
Yeah.
Excuse me.
Bless you.
All right. So yeah, you want to keep your brain active because you're going to
Yeah.
boost your reserve through activity.
Right.
You do not want to
Yes.
sit on the couch with a remote control and spend all day watching television.
Right.
A little bit of
Absolutely.
television is good, but
Yeah.
engage with things, read,
Yeah.
become a member of your local library, get out podcasts,
Yeah.
audiobooks, etc. Go to
Absolutely.
lectures, get onto your computer, do games, do puzzles, see your
For
friends,
sure.
socialize. Even if you're disabled, try and get a bit of activity. If you're
Yeah.
using if you're using a wheelchair, do upper arm strength, upper arm exercise, build up a light sweat that way.
Sitting cardio.
Exactly. But do things to keep yourself active.
Yes. Well, thank you so much. And thank you again for being on the podcast. And I
Okay.
hope to have you on again. If you wouldn't mind, I'd love to have you on again.
My
So
pleasure.
it's always interesting. You're fascinating to me. And I just really, really, really appreciate you being on.
My
So
pleasure.
I
Thank you for the
appreciate you.
interest.
Thank you. Guys, don't forget, I will let Dr. Feinstein know when it's on, and I will have all of his millions of things that he's accomplished on the bottom of the show notes. So don't forget that that will be on there. And again, thank you, Dr. Feinstein, for joining us. And thank you guys for joining another episode of Move It or Lose It. Don't forget to subscribe and to give us your feedback of what you thought about this interview. Thank you so much. Thank you so much for joining me for another episode of the Move It or Lose It podcast. It would mean the world to me if you subscribed and left a review. Remember, you can find me on Apple, Spotify, Stitcher, and YouTube. New episodes of the Move It or Lose It podcast air every other Wednesday. If you have any suggestions for future guests or topics, please visit my website at www.msdisrupted.com. Until next time.